Can I come in? All right, thank you. Hi, my name is Jessica. I'm going to be your nurse today. Tell me your name and date of birth. Okay, Charlene Knight, 8839. And your allergies? Latex, Spinodine, and penicillin. All right, good. We're going to make sure not to use any of those today. And can you tell me how you're feeling? I feel like you have to pee, but you can't. Yeah, I saw on your chart you haven't urinated in 10 hours. All right, well, we'll be able to fix that for you. Let me just take a look at your bladder. Okay. I'm just going to roll this down. Okay, and just check for distension. Yeah, definitely. Yeah, your bladder does feel distended. Okay. Your doctor has ordered a Foley catheter for you. You have done that before. You feel comfortable with the procedure? All right, that's good. It's going to bring you immediate relief. So hopefully we can get that done for you and make you feel better. All right, while I'm down here, I'm going to check if you need any peri-care, and she does seem like she had just recently had some peri-care done. If it was needed, we would make sure to do it before we start the procedure. Okay, I'm going to get you ready because once I start, I'm going to need to maintain a sterile feel, okay? So pull this up, all right, and I'll try to do this as quickly as possible, okay? Get my area ready. Put it on my waist. Okay. Sorry, Foley cath sterile kit. It would check for any compromises, moisture, and there is none. I would check the expiration date, which is for 2017, so it's still good. For these purposes, we're going to use this kit even though it has latex and she's allergic. We're going to pretend like that's not the case. Okay, for our open mix, do hand hygiene. Well, let me put this down first. Get my hand ready. Okay. Hold some hand hygiene. Okay. And to begin the procedure. Okay. I'm going to open the kit using the 1-inch border away from me first, and then slowly, hopefully, keep it down, fold it down so it doesn't pull back into each other. Okay, and once more away from me. Okay. I'm gonna use this drape here by just touching the shiny portion. It's a little folded in, so I gotta be careful, but this is just the shiny portion and the 1-inch border. So open it up. You don't want to shake it out. I need to flip it onto the other side, so I'm going to switch it like this. Make sure only to touch the 1-inch border again, and shiny side down. I'm going to just lay it right here. Nope. A little messed up, but it'll work. Open up my gloves. I'm going to look right over here. Make sure to not put my thumbs in the middle. I don't compromise with gloves. I'll make sure not to turn my back on my sterile field. Okay. I glove my dominant hand first by just touching the inside cup of this glove, stepping back, supinating my hand, and starting in, watching for my thumbs. Okay, that's sterile now. I'm going to stabilize here and put my dominant hand into the cup of the sterile glove. Lift, set back, make sure I keep above my waist, supinate my hand, and insert my glove into my non-dominant hand. Okay, sterile to sterile now, and kind of adjust a little bit. Okay, just keep them up. I am going to not use this today. I'm just going to put this on over here. I'm going to adjust my kit. Making sure to put it in within the 1-inch borders. And then I'm just going to get everything ready for the procedure. Just going to take off plastic wrapping. So once I move over there, I'm going to have only one sterile hand. I'm going to open the hydrogen peroxide. A little bit closer. Try not to cross over sterile as much as I can. I'm just going to douse them and put this over here on the side. And open up the lubrication. It says tear here. It's giving me a little bit of trouble. There we go. And I'm going to put some generous amount on the top of the cap tip. And then I'm going to put a little bit extra right here at the corner of my box, just in case I find that I need some more when I get in there. Okay. And then last, I'm going to open up my syringe with my sterile water for the balloon. Attach it to the cap. Make sure it's as secure as I can possibly make it. Alright, and put everything back in the box. Okay, and at this point I am ready to move over. Place it right in the middle here. Okay. And now I'm going to use my non-dominant hand to spread open the labia, identify the urinary meatus, and I'm going to keep my hand there for the rest of the procedure, making sure not to touch anything sterile with my non-sterile hand anymore. Okay. And now I'm going to clean with cotton balls, farthest first, back and away from my sterile field. Closest, back and away from my sterile field. Inside, and back away from my sterile field. Just going to keep, and I'm going to do the same pattern again, the next 3 cotton balls I have. This is all ready to be moved. This is no longer sterile over here. Okay. All right, Miss Charlene Knight. All right, we're ready to move forward. Would you take a deep breath? And so I'd be a little uncomfortable, but you're going to feel immediate relief, okay? All right, and I'm just going to make sure not to let my sterile hand touch anything that is not sterile. Labia as I introduce the catheter. I see urine at this point, so I'm just going to go about 1 more inch further. Okay, and I'm going to use my non-dominant hand to stabilize. Okay, and now I'm going to fill the balloon. 10 milliliters of sterile water. Check. Tug it, and it is secure. So now this is no longer a sterile procedure. We're ready to finish it. I'm just going to tape it to a leg here, allowing for some slack for movement. And then I'm going to attach the bag to the bed frame, not the rail. move this away and cover her up. You did really well, okay? You feel better? Oh yeah, you do? Immediately, right? That's good. That's all I wanted. Okay. At this point now, I'm going to just raise the bed rail. I'm going to check the urine output. See, as I see 300 cc, I would maintain input and output levels. I would provide peri and cath care per the company policy. Document how she took the procedure, which she did well, and yeah, that's good, right? Let's do this over.